I had the good fortune of living and working in Kathmandu, Nepal from 1990 to 97. And during that time, I was often asked, being a physician and also being a Buddhist, to come over to one of the local monasteries and have a look-see at a medical problem that was going on there. In the early days, the medical problem was usually an epidemic rather than a single monk or nun who might be ill. And in the early days, I encountered epidemics from chickenpox to scabies to dysentery to tuberculosis to even meningitis. After bouncing around from monastery to monastery, treating multiple patients for epidemic-type diseases, I came up with the idea of forming a nonprofit foundation called the Himalayan Medical Foundation, or HMF for short. And my reasoning was that if we set up clinics in the monasteries and had them open on a regular basis, we could treat monks and nuns early on in their illness before they suffered too much and before they spread their illness to others. So the simple formula worked. We got some seed money from a few organizations, and our idea was that we would provide free medical care to whoever came into our doors. The monks and nuns, for the most part, are indigent people. They don't really have the funds to go see a physician. So we were definitely filling a niche. And within a short time, the epidemic stopped. And we were just then seeing more routine problems. After about a year and a half of operation, lay people started showing up to our clinic doors. Remembering Nepal is one of the poorest countries in all of Asia, many of the people in the Kathmandu Valley don't have access to medical care and they can't afford medical care. So once the word was out, hey, there's a free clinic, people start showing up. We had to then make a decision, were we only going to extend our services to the monastic population, which had been our original idea. But after not much discussion, we decided that we would include our services to anyone that came through our doors. So today, several of our clinics actually see many more lay people than we do the monastics. Today we have 6 free clinics throughout the Kathmandu Valley, and by far our busiest clinic is at the Benchan Gampa in Swayambhu, and this clinic is open on a daily basis. You may find it hard to believe, but actually patients start queuing to be seen at the clinic as early as 3 a.m. in the morning, and the clinic opens at 8 a.m. The reason being is that we can only see so many patients per clinic number of hours, and so the patients are willing to line up and wait as long as 5 or more hours in order to be seen. I'd like to point out that our clinics don't take care of just acute medical problems that are easily fixable. Many of our problems are life and death situations. Many Nepali families live on $50 to $75 a month, period. And that leaves no money whatsoever for health care services. So by the time many of these patients get to our doors, they are acutely ill, in bad shape, and the only thing that separates them from life and death is what we're able to do for them in our clinics. What is the present and what is the future vision of the Himalayan Medical Foundation as it stands at this time? It really depends upon the amount of donations. We operate year to year based on how much money we're able to raise through our donations. If we have a really good year, then we're able to do special projects like building more shower houses or toilet facilities. If we have a leaner year, then we just concentrate on keeping the clinics open, keeping the pharmacies supplied with the medications that are needed. But the bottom line is the sky's the limit on what we can accomplish in Nepal and in the Kathmandu Valley. It just is money driven. It depends on how good of a year we have donations. So depending on the response, we can stay at a baseline and continue to do what we're doing. If we have a really good response or a number of new donors come forward, there's many things that we can do to improve the quality of life of the people in Nepal. You have to remember, the average life in Nepal at this time is often somewhat dismal. They've undergone a tremendously difficult time with the political system. They've gone through 2 kings. The government now is at an uneasy truce with the Maoist and the Democratic Parliament. The government has been fairly paralyzed and not very good at helping take care of the average needs of the citizen. So the work of the Himalaya Medical Foundation is one of the few bright spots in their life. They can actually go somewhere and receive free care with kindness and compassion, and just that small gesture can make a big difference in their life.